hyperactivity disorder. ADHD is a chronic condition that affects millions of the children and often continue into adulthood. ADHD includes a combination of persistent problems such as difficulty sustaining attention, hyperactivity, and impulse behavior. ADHD is one of the most common neurodevelopment disorders of childhood. It is usually first diagnosed in childhood and often lasts into adulthood. ADHD or attention deficit hyperactivity disorder is a behavioral condition that makes focusing on everyday requests and routine changing. People with ADHD typically have trouble getting organized, staying focused, making realistic plans, and thinking before acting.
ADHD is associated with the way certain neurotransmitters, chemicals in the brain that help control behavior, work, especially dopamine and norepinephrine. People with ADHD can seem restless, impulsive, and have problems concentrating. Studies shows that ADHD may affect certain areas of the brain that allow us to solve problems, plan ahead, understand others' actions, and control our impulses.
Adverse social family environment such as through parenting education, social class, poverty, bullying, peer victimization, negative parenting, maltreatment, and family divorce are associated with ADHD. However, the design used so far have not been able to show that these are the definite causes of ADHD. When children with ADHD enter a social setting, they may have a hard time sharing, task turn, listening, and picking up on social clues. They often become bored, distracted, and check out of the conversation. Children with ADHD may have a hard time managing their emotion when interacting with their peers. Individuals with ADHD often experience social difficulties, social rejection, and interpersonal relationship problems as a result of their inattention, impulsivity, and hyperactivity. Such negative interpersonal outcome causes emotional pain and suffering.
Start your assignment तो मैंने पिछली क्लास
When I'm giving a task in class, I'll often try to avoid doing it because in my head, I think it's boring and repetitive. So I'll try everything I can to avoid starting or initiating the task that has been given to me. And where I'm supposed to be sitting, I feel restless. I feel like I want to fidget more. And I'll often leave the seat when sitting is important. And I am terrible at organizing things. Often my things will be scattered across the entire desk. And in it, I won't even have the important things that I'll need to do the task I've been given. And because of this, I will also cause a lot of commotion and distraction in the class.
लास्ट टॉपिक तक पहले हम उसको रिवाइज करेंगे और फिर हम आगे के जो टॉपिक्स हैं उसको कवर करेंगे सही तो आप लोग अपने नोटबुक्स में
Miss has started her class, and I think we're going to study about narcissistic personality disorder. I should be paying attention in class, but instead, I have other things in mind. I'm playing with my nails, and often looking around. Also, I'm not comfortable in my seat. I can hear what she's saying, and it's all going in my head, but it's like nothing else stays in it. Oh no. She just asked me a question. What was she just talking about? I know I was paying attention. How can I forget? I just listened to her.
तो आप इधर क्यों देख रहे हो? आपका कंसंट्रेशन किधर था?
नहीं
कंसंट्रेशन इधर जब भी आप जवाब नहीं दे सकती हो, आपका माइंड किधर है? मैं इधर पढ़ा रही हूँ और आप इधर उधर देख रही हो और पूरी क्लास को डिस्टर्ब कर रही हो.
Now the miss is speaking to me directly and is still not paying attention. Other things are more interesting to me than listening to her. I think I'm way too distracted.
और अगर आप जो हम लोगों ने कल टॉपिक्स पढ़े थे उसमें बहुत सारे टॉपिक्स हैं, तो उन्हीं टॉपिक्स से रिलेटेड मैं आप लोगों से कुछ क्वेश्चंस करूंगी और वन बाय वन.
I feel very restless right now, but I think she's going to ask a question that I already know about. The best part, I know the answer to that question.
पैरानॉइड पर्सनैलिटी डिसऑर्डर.
Okay, I can definitely answer this question. This is easy.
आप गलत बता रहे हो. तो जो है पैरानॉइड कंडीशन, वो जो बॉर्डरलाइन पर्सनैलिटी डिसऑर्डर्स होते हैं उनमें ये साइकोस सिम्टम्स होते हैं. तो इसके अलावा हमने और भी पढ़े थे, जैसे नार्सिसिस्टिक पढ़ा था, ओवररेट पढ़ा था. तो मैं नार्सिसिस्टिक का प्लीज राइट. शी इज राइट. आप अपने टर्न का वेट करो. पूछा आप बोले तो दो.
After seeing that I'm having trouble at school and at home, my mother and me finally decided to meet a psychologist. They first asked me about my problems and my history. It seems that these symptoms have also been occurring from my mother's side. My siblings exhibit these symptoms too. She told me to take a test. For example, the ASRS version 1.1, which is called the Adult ADHD Self-Report Scale, and then she booked me a psychological counseling. I was told to go attend these sessions to help me cope with my ADHD. The psychotherapy included training for time management skills, reducing impulsive behavior, better problem-solving skills, coping with past academic failures, improving self-esteem, and improving relationships with other family members and friends. Hopefully, with all this therapy, I'll get to live a normal life. ADHD can be treated using medicine or therapy, but a combination of both is often best. Treatment is usually arranged by a specialist such as a pediatrician or psychiatrist. There are 5 types of medicine licensed for the treatment of ADHD. These medicines are not a permanent cure for ADHD, but may help someone with the condition concentrate better, be less impulsive, feel calmer, and learn and practice new skills. As well as taking medicine, different therapies can be useful in treating ADHD in children, teenagers, and adults. Therapy is also effective in treating additional problems such as conduct or anxiety disorders that may appear with ADHD. Some of these are psychoeducation, behavior therapy, parent training and education programs, and CBT.